All right, I'm going to call the April 7th meeting of the Board Finance Subcommittee to order. Been
You want to
That was me.
mute your.
Yeah.
I
muted me.
Sorry, we're having an echo on the Zoom. I'm going to note that we have two members absent. Trustee Kirby is traveling and President McNally is ill today. So we do not have a quorum. We will not do any straw votes, direction on our budget process or recommendations to the board. But we are going to receive public comments and we are going to proceed with the discussion items and receive the information prepared by staff. So with that, I'll go ahead and see if there's any public comment. No members of the public seeking to comment. We'll go ahead and close public comment for the agenda and agenda items. And we'll move to item 3A, discussion of the Child Youth Behavioral Health Initiative. I believe that would be, all right, I'll let you take it from there.
Hello and thank you, Trustee Caston, Dr. Morales, and the rest of the subcommittee. Thank you for the opportunity to come and speak to you about the CYBHI, or the Children, Youth, and Behavioral Health Initiative fee schedule program. We are looking forward to sharing this information with you because this is giving us an opportunity to look at funding and support for our programs that help the whole student in a way that is approaching a much more sustainable model throughout the state of California. I'm Stacy Desideri, Executive Director of Wellness and Engagement, and here with me today is our Director of Mental Health and Community Schools Development, Eric Lochte, and he is here today to give you a small glimpse into our participation in cohort 2 of the CYBHI fee schedule. Take it away.
Yeah, good afternoon, members of the Santa Rosa City Schools Fiscal Subcommittee and folks in the community. Today, we are pleased to present an overview of the Children and Youth Behavioral Health Initiative, or as you'll hear us referring to it as CYBHI, and talking about our district's participation in it. The CYBHI fee schedule represents a structured reimbursement framework designed to support expanded mental health services for our students. As part of California's commitment to improving behavioral health outcomes for children and youth, this initiative provides sustainable funding for critical services that many of our students need. Santa Rosa City Schools has recently been accepted as part of cohort 2, an experimental early adopters cohort to participate in the initiative. This positions us to enhance our behavioral health offerings while establishing a revenue stream that supports these essential services. A key element of our implementation plan is the introduction of wellness coaches. We recently created a new position called wellness coach, specifically designed to support student mental health. These wellness coaches will not only expand our capacity to deliver timely interventions and support, but importantly, their services will be eligible for reimbursement under the fee schedule, generating offsetting revenue for the district. We have strategically partnered with TAD Health to manage our electronic health records and facilitate the billing process, creating an efficient system that maximizes reimbursement while minimizing administrative burden on our staff. This partnership will ensure that the billable services provided by our wellness coaches and other qualified staff are properly documented and submitted for successful reimbursement. The topics today we'll discuss outlines the specific services that qualify for reimbursement and their corresponding rates, how this structure integrates within our existing budget and service delivery model, and making sure that we all in the community understand the way these things are going to fit within our budget. And Joel will speak a little bit about the way the revenue will come in as well. Should I just go into it? Joel, you want to introduce yourself?
But actually, I'll let Lisa talk about it.
Okay.
She knows everything.
Sure. So Lisa August, Associate Superintendent, Business Services, Chief Business Official, and thank you for being here. And yes, where we will see this is in our local revenue. It'll be, it will come in as a reimbursement. And so in that way, it is unrestricted, but it's really, it will come in a way that we will use it to pay the staff who are providing the services and to be able to provide that continuum. So it's we will be updating the way that, we collect information from parents during the summer, asking them to share billing information with us as far as their medical insurance information. And it will allow us to actually bill directly to providers or insurance companies like Kaiser, Blue Shield, all of those. There's a fee structure set up by the state that sets those rates, and it again is a reimbursement for when students are seen. It does not impact families out of pocket. It does not affect their co-pays or anything of that nature. It's just to help the districts who are providing services to be able to recoup some of those costs because we are a provider of need.
Excellent. Yeah, so, and I basically wanted to make all of this information available to the committee at request. I don't want to go through the whole thing because I wasn't sure exactly how much time we have for this. But the areas that we could really kind of go into are the structured rates that exist within the fee schedule, the documentation and information that we need to share with the community to reassure parents that them sharing their health insurance information with us will not cause them to be billed or charged in any way, shape, or form. Because that is one of the main technical challenges for us, because we haven't necessarily been in the practice of collecting insurance information from our entire population. And in order to maximize these reimbursements, we're going to have to start doing that.
One of the things that is critical to understand is that when Lisa uses the phrase providers of need, it's important to know that one of the more prevalent barriers to students and families receiving the services that they need is ease of access. And the state of California, HCS, CYBHI all recognize that by bringing these services to school, we remove a barrier of access for our families, making it quicker and easier for our students to get the support that they need.
So we are doing this in partnership with the Sonoma County Office of Education, and a good place to start might actually be a parent and caregiver information sheet. If I could share, I'll pull that up.
You said we were phase 2,
Cohort
cohort 2. For cohort 1, is there any data yet on percentage on how it's going for them on recouping funds and billing?
We're happy to be part of cohort 2 because cohort 1, I think they get to start billing around the same time that we did, but they had to go through all the pain points first.
We're ahead because of the work we have been doing in the last few years with building up the mental health team. We have a whole team of practitioners that are already ready to go, and we've kind of merged with cohort 1 because it's taken them so much longer to do the things. This is a brand new program at a scale of the entire state. And so the moving parts that were necessary to get into place have taken months longer than anticipated. And so the benefits of being in cohort 1, and then even cohort 2, there's some cohort 3 schools that are coming up to us as well. And, you know, it's kind of a mad dash to get that successfully working.
And we did have an implementation, a capacity grant that helped us in the short term so that we could get the infrastructure in place, get things, you know, ramp up with staffing and things like that prior to actually having income coming in on the actual fee schedule.
And that capacity grant is allowing us 2 years worth of support. So this year, we're using it to get our partnership with TAD Health going. We also used it to get the wellness coaches into the secondary schools with the wellness centers already. But that is buying us that time while we begin to build, because our goal is to ultimately offset the cost of running these programs and services that right now don't have any support.
And to that end, so we talking about the wellness coaches. That position we know is going to be able to be used for reimbursement of this program.
Correct.
What of our existing positions and programs do we expect to have be able to be reimbursed in this program?
Our school-based therapists can reimburse. Our school psychologists, you pinch me if I'm going off track.
All right.
School psychologists can also bill for initial assessments.
And by
The,
initial assessment, assuming IEP.
Actually, it may be good for me to put the whole fee schedule up on the screen so that we can see all.
Yeah, that'd be-
Mhm.
Because the way we're working this is we're starting off with the school-based therapist. And then once the wellness coaches become eligible for reimbursement, we'll go with them. And then there's a whole other way that this can be done. So if I share, I do not even see the share button anymore.
There,
Sorry.
it looks like this little,
Oh.
what two things?
No, I'm
Here,
talking.
no.
I just.
Share screen.
I gotta allow you to do,
Just changed you to.
Actually, just got it.
Make this bigger.
It's usually-
I get that, I know, you gotta get them.
It's usually here. I think the button.
Sometimes it goes away because of that.
Or because I tried to change your rule to promote you, because you said that you couldn't, and. Thinking that.
Yeah, no, the button
maybe it
went away.
caused a problem rather than.
No, I think I have a great solution. I'm gonna share this list of links with you and
Perfect,
then you can share.
yep. Let's do that.
Perfect.
Just a second.
So what we want to look at now, Lisa, is the fee schedule rates CPT codes link on there.
Let me get it up here. Let me get it to work. Okay. In between all of these different things. This. Here, and then I will also share in here. Screen sharing. There we go.
So let's see.
Is this what you wanted?
Yes, this is
All right.
exactly it. So this is the scope of services documents. If you could scroll down, we can see that the way this is laid out is, this is something that's very familiar to health practitioners. You have a CPT code on the left, and then a description of what the service is. All of these are in the service category of psychoeducation. We can see the list of people who, some of those people work within our system. All of those are what is called authorized providers. And so you can see here, so skills training and development. That is a 15-minute conversation you have with a student about a specific health problem. And PPS school social workers, PPS school counselors, school psychologists, those folks, if they did that for 15 minutes and entered it into TAD Health, each one of those people that did that each time would get $20.11.
I want to correct. They wouldn't receive it. They would generate revenue for
They
the
would.
district as a
The
reimbursement.
district would.
I appreciate that.
A question on that, are we currently, so just structurally, as we look at the service descriptions and the eligible practitioners, are we currently aligned within our job descriptions to have the people who are responsible for doing those services be someone who's an eligible practitioner?
So within certain job categories, yes. And in other ones, I think it may require some meeting and conferring. And that's one of the reasons why we're starting off with with a smaller group. It's experimental. There's a lot of ups and downs right now. We don't want to go wide until we understand this to be a successful program. If we scroll down, I'll show you one of the areas that we do currently do a lot of. So we're going to go all the way down past screenings and assessments to keep going, Lisa. So we can see there's a bunch of stuff in here as we scroll through that we currently, stop there, please. Those are things that we currently don't do. A lot of these screenings, a lot of these other things that we could be doing that could open up additional opportunities for revenue. So psychological testing and evaluation, that is a PPS school psychologist. So they can get reimbursed for doing the initial assessments. They are already doing those things, and they're reimbursed under the school MA, or the Medi-Cal for school counselor, for special ed. But the rates aren't as predictable, and they're done on a cost negotiated resettlement basis, which can take a long time. The fee schedule, years, and has a very, very challenging like sort of accounting structure to it. This is done much more simply, and it is reimbursed on 30 to 45 day basis. So they will, the timelines are much tighter.
Is this just private insurance, or is this also like private insurance that's managing Medi-Cal patients?
Any third party payer except for a few rare ones. So that is all of the Medi-Cal students, all of the other third party payers that aren't, I can't remember what they're called. There's a rare form of health insurance that some people, disability health insurance or something. There is one that maybe 5% of
SDI or something.
there is something. I'm not exactly sure where it is right now. I can look it up. If we scroll down, I'll show you the currently we have school-based therapists that are providing, keep going into treatment. There we go. Psychotherapy session individual, 16 to 37 minutes. So each one of our school-based therapists, every 16 or 17 minutes, that unit of service would generate $67. That would come in as local resident revenue that we would expect to offset some of the expense to provide the service.
Just to clarify, it's highly unlikely that we will be able to recover all of our costs, but it's a service that we're already providing and paying for.
Yep.
That we, rather than putting it out there for a potential reduction, because there is a way to offset this, and it's a service that families have come to rely on. And it's
Yeah. And so all the work that my team and I and our whole department have been doing to set us up to be able to get reimbursements has been with that eye on the future challenging economic times. And also the equally challenging problem of what happens when we remove services that we've been providing. Right. Especially services that are this instrumental in the safety of a very big part of our population. So, and we can see psychotherapy for crisis. We have staff all day long working in, preventing or assessing psychiatric crisis of our students. And so all of the times that we do suicidal risk assessments, those would all qualify for that particular CPT code.
Do we have a rough understanding of, so if 60 minutes of psychotherapy for crisis is $126 on the fee schedule, do we have a rough understanding of what percentage of the FTE in that role, like we have an idea as to where we could get for offset?
we can bring that back,
Okay.
because it's really going to vary widely
Right,
based on the position and what
happens
where their placement
in the community, and
a lot of different factors. I will say that we have conservatively budgeted in our multi-year projections for the reimbursement in the first 2 years, because we don't know how quickly it will, take root as far as people providing their insurance information and things like that. And so we've offset some of that expected revenue with some of the implementation or the capacity grant,
Capacity.
because that's part of.
It's also what the capacity grant was intended to do.
Mhm.
We've looked at, so if we've tried to factor, let's say we have 30% of the insurance information. Those workflows are gonna generate significantly less than if we had 80% of the insurance. So that's a progression. How long is it gonna take us to get the critical mass of insurance information and maintain those systems? Again, that's technically a very, very big challenge. But we anticipate, well, it's just really hard to come up with an actual number for that. But we're expecting, 20 to 30 productive hours per staff person, per week. And we're gonna be really looking at how many of those, services that we can provide. Currently, we don't get any type of revenue generated when we do case management. And case management is one of the CPT codes that are on this. So there's a whole bunch of other things that we can't capture right now that we well under this. So we think it'll average out some of those times where you're not actually with a student.
What's the plan we're gonna have it as a required field on an application, or what's the plan to actually capture the medical information?
I don't believe we can require it,
We
but,
can request
but we
it.
can request it, just like parents completing the alternative income form.
Okay.
It's also a similar process right now when a family is sitting at their IEP meeting. One of the lines that they always sign is, if your child is provided a service that would be Medi-Cal billable, you give us permission to be able to. So right now, we don't collect the insurance information for our community.
Mhm.
And there's not a simple way in Aries to be able to do that, although we are working with our information and evaluation team. But we do have a lot of families who will agree and consent to the service, because if I'm going to be working with a school-based therapist, we could potentially build that into our consent process so that we can work on that process. That's one of the hurdles that have to be explored.
Is this also available at like our dependent charters and for contractors?
Yes, this is a California-based program. So, for example, I started speaking with our KKIS, Keeping Kids in School partners through Seneca. And I was asking, have they started to explore the CYBHI? Because if we have a community-based organization who qualify under the service providers, the eligible practitioners,
Mhm.
sorry, I want to use the right language. If they fall into one of those categories and they are providing services for our students, that is, can you speak a little bit to, that is an option?
One of the reasons that we've been pushing for wellness centers is that they have additional spaces in them for community partners. And so when a community partner who employs folks like this and has an MOU with us, and we determine them to be like a participating provider, they now have access to this fee schedule, just like our staff would. And so they would either be able to utilize our system to do the time accounting and do the input, and we would essentially contract with them for the amount of time they provide, and just pass through the funds to that organization as a way to motivate them to come and provide student supports, and as a funding model for those supports on our campuses. It isn't just exclusively for us, it's for folks that we welcome onto our campuses.
I think I'm gonna have to elaborate on that. So the charter schools will receive the services, those students can receive services, and if we get their insurance, we'll be able to serve them, just like, we serve daycare and childcare, as well as we do a similar Medicaid administrative oversight, and Medi-Cal billing in the other one, and we do include our contracted agencies that provide that for us in those as well. So I'm assuming it's the same thing.
Oh, second thing, I know like Imam Dodd did on-site therapy through some of the, it was definitely through LCAP, I think, for some of the private charters. So this could,
Yeah.
this could offset that.
Yeah,
And then what about it? Is this something where with like Kid Street, we would be able to offer these services to the independent charters?
Who's their LEA? Are they?
They are their own LEA, so.
Okay.
I mean, there are things that we can do through an MOU for services potentially, where if they are a qualifying cohort, then they can pay us. There's ways that we would then become like a community-based organization for them, but that's not, I would say that would not be something that we would be ready to do anytime soon.
Yeah, it is very LEA specific. And our LEA has had to register with the Department of Healthcare Services. We've had to set up a portal with the state third-party administrator called Carillon Behavioral Health, and the amount of information security that we've had to engage in order to ensure that this protected health information, because we're not used to trafficking in protected health information, and so we've had to really up our game when it comes to the data information security. As we start proposing to transmit this information to a third party, we have to get it right.
Because it works differently than
Yeah.
how we are securely submitting information to CDE.
Yeah.
It's a completely different system.
And I'm asking this because I know we're gonna be engaging in a lot more charter conversations in the future. And so knowing our intent is to make sure that those charters are providing assessments and special education, is this gonna be a tool that we can use to help support that compliance, or is it gonna be on?
It's something we'll have to look into. At this point, no, it would be something we would have to look to see if we could in the future.
But they would still have to qualify.
They
They
would
would
still
have to
have
do
to
all of the
register.
legwork that we've done.
Right, I think that where we get into the confusing part of it is what we have to look into is that they are, for special education purposes, considered a school of SRCS. For regular gen ed, they are not, they are their own independent LEA. So if they're in this kind of
And I'm
weird limbo.
specifically
that we have
thinking
to
of
look at.
special education, that's one of the concerns of the community.
So special ed students, because special ed services are supposed to be funded directly from the federal government, this is not a special ed program.
Right.
These are, because those services are, they're supposed to be funded out of the federal government. It would be like double dipping, yeah. So this is a way to expand the mental health services for general ed. So an initial assessment that you're doing, the kid's still technically a general ed student until you've found that he meets or she meets the criteria, and then they become a special ed. So those initial assessments are reimbursable regardless of outcome.
And an assessment that leads to accommodations through a 504, which can include therapy and so that support. That would
Those
be
are
under
general
this-
ed students.
Right,
Yeah.
that's gen ed, not.
Yeah, and actually, services provided to a special ed student that are not pursuant to their IEP are also eligible here.
Okay.
So,
So a
yeah,
special ed student who does not receive ERMS counseling as one of their services, who sees a school-based therapist, that would be
That would be.
qualifying under CID.
Because that would be under the gen ed.
Right.
School or anything
um,
else?
I mean, I like the idea of showing a couple of these brochures that I have linked because they're really, I want to be communicating every time we do this. I think it's really important that we remind the community that this is free of charge, that their health insurance company is not going to change their out-of-pocket limits. They're not going to impact them. They're not supposed to even receive an explanation of benefits. So it's supposed to be completely separate.
So which brochure do you want me to pull up?
Let's look at the DHCS brochure. Parent and caregiver information. And so when we go to that, we can see that, It explains how it works. And it is very clear that schools are offering free mental health services and supports to students and families. We can't say yes or no to a student depending on what kind of insurance they have. We're gonna be serving students in the same way that we do now, which is based on need and availability of support. And trying to do the insurance collection at the point of service, at the point of registration, wherever we can. I'd love to see a change to our emergency cards so that information showed up there. We're really working on it every way we can do that.
And that's how most districts collect that information.
Probably sports signups as well.
Right.
Yes.
You know, that's the place where we have the most experience in collecting that information.
I mean, my reason for wanting this to be so early in this committee's work plan is a lot of what was added with the one-time funds that we no longer have is related to these areas of service. So I'm just, what I'm trying to explore here for this committee's work is financially, even if we're being conservative in the estimates, how hopeful can we be as we seek to maintain what was added, but now taketh away.
Yes.
And so I guess to the extent that looking at that big picture of this, it seems like one factor is we need parents to put the medical information in so that we can actually use the system. Two, it sounds like we need to keep working to realign our practitioners and job descriptions to make sure that they're matching appropriately with who's providing the services on campus. What are the other big factors that we need to make sure we're tracking and driving in order to make sure we don't have to be as severe in our cuts to this area?
I think that the way this was set up was very much in order to address the ends of those funds. We realized that, and the state realized that schools were used to this support. And so this is in response to that. And the way this is intended to work is to have multiple providers at different levels that work in schools. So right now we're working on the school-based therapists, and you hit the nail exactly on the head when you brought up the idea of aligning other work providers. Because currently, right now in our system, we have PPS school counselors, probably at this very moment, doing things that could be reimbursable on this. And I think the real synergy for this funding model comes when there's multiple people. You've got a school psych working, you've got a school-based therapist working, you've got a wellness coach working, you've got a school counselor working on it. And so all of those different providers can offset more and more of the sort of collective support that we provide students. And some of those are funded in different ways. And so, I think we could, if we had multiple users going, that's when we're really going to see the benefit of this. When you have one provider trying to offset as much of their job expense as you can, it doesn't work as well.
Yeah, and that doesn't seem to be what it's designed to do anyway. It seems to be designed to offset a lot of the things that we're doing. So for cohort 2, when are we expecting to be able to start doing our first? When are we going to send the first reimbursement request?
We are currently providing, I think I've got, I think there's probably 300 services that are already eligible for reimbursement. We haven't finished all of the portal configurations for our secure transfer. But the reason why we went with TAD Health is they were ready and flexible enough to deal with all these changes. And we're hoping that we're already within the reimbursement period. We just aren't set up to do it yet, that we've provided services that will be reimbursed. Once we get connected to DH or to Care Law and Behavioral Health, and once we get the health insurance information, the Medi-Cal student insurance information is going to be done automatically by the state. So for Medi-Cal parents, all we're gonna need is permission to share information with the Department of Healthcare Services.
So like someone who receives services this month, if they were to give us their medical information in August, we would be able to go back and reimburse for this, for something that happened this month?
Don't know if August goes beyond a timeline because it's a new school year. So
But if they were as part of the consent for service right now, if they handed us that information, as soon as we finish the portal between
Mhm.
our, information system and Carillon, we could start providing the reimbursements now. So we wouldn't,
January first, actually.
right, so we wouldn't go back prior to January
January.
I haven't
first.
done January first, right? Yes, they,
Yeah,
where there's some question as to when schools can actually start, what the sort of start date was. But I'm hoping that it's,
Sometime prior to today.
yeah.
but
I'm
not
just, I mean, I was looking at the
as
data, so,
far
and so, and then roughly when are we currently asking folks for their medical information at the time of service?
We currently are not, because we don't have a safe, we don't have a secure way to transfer it, store it yet. And we're waiting on that through our portal.
And that's the portal, and it's already in works?
Yeah.
Okay.
Yeah, and Tad Health is going to be helping with us roll that out. What we'd like to be able to do is send parents the forms securely to their phone, through their phones or computers, have them electronically sign them, and then enter the information. But it won't actually come into our system. It'll go straight to the secure platform that we're using for electronic health records. So that's what we're hoping for, and we're just waiting on a few other technical challenges to be addressed.
I get the strong sense that you don't want to give me a date, but when can we expect that to be done by? Roughly, like, is this a month? Is this a weeks? Is it days?
It's hard to give an estimate of a timeline that I'm not responsible for.
Right, I know.
And so I'm frustrated that it hasn't happened already and want to do it as soon as possible. I think that it's probably most realistic for us to really push for health insurance information in the fall, so that we are getting, that we're starting next year with as much of a push to actually do campaigns about medical insurance information. And if we don't have a platform set up yet, we're going to be doing paper at all of our back to school nights, at all of our welcome back to school events. And I'm going to have my team at all of our schools with a table asking, with flyers, and we'll have materials, we'll have it on our Facebook. This is why we want this information, because we believe that mental health should be in schools. So right now we're getting a lot of those bugs worked out. I really expect us to be pushing that seriously next year.
Okay.
Thank you. I think we can stop sharing.
I don't have any other questions, so. I appreciate getting more in depth, like, it's good to understand the time.
Yeah, I mean, we got all day. I can keep going.
Maybe other
I mean,
people don't.
Yeah, I think I think this is incredibly important, because if we can't replace these funds, we need folks to have an understanding of the fact that this is what happens when money runs out. And so if these funds can replace those, and we can keep the services, and if they can't, then.
Well, and it's also important to know that under this program, there are certain services that we can reimburse for. This does not do everything. This is looking at behavioral health, it's looking at mental health. There are a lot of services that are provided in our district that are incredibly important, that will never be reimbursable.
Right.
Simply because that's not what this program does. But the kind of mental health and behavioral health support that we're providing can be offset. And it is something that Santa Rosa is one of the front runners as to providing these services prior to there being a way to pay for them.
Yeah.
That investment by our district and by our leadership is one of the reasons why we are able to move so confidently into cohort two.
Mhm.
Because there are programs out there and districts out there that are learning how to do the reimbursement and learning how to have these staff in their programs.
Provide the
You're
service.
already providing the services.
That's actually one last follow-up question. What do we think the timeline is for completing a review of alignment for positions within the areas where we're not currently providing services, or we're providing them but not clearly with the right practitioner?
I think that, due to the fact of where we are living right now with everything else
Mhm.
that's going on with our current
It can be
positions.
next year, it can be the year after.
It would
Yeah,
definitely not be this
Yeah.
year. It would be, for example, one of the things that we are bringing forward right now is the wellness coach one position.
Yeah.
There are two different wellness coach positions. There's wellness coach one and wellness coach two. We did not propose both positions at the same time.
Mhm.
We are going to do wellness coach one this year, and then wellness coach two, we are proposing to bring in next year. Because we know that the wellness coach one is a way for some of our current staff whose positions may have been reduced to be able to potentially transition into other roles within our district that will have some fee sustainability built into them, where other positions may not. So it's an ongoing process, and we're actively working with our bargaining unit partners to be doing that at a pace that's comfortable for all of us.
And I think, so I understand for the creation of new positions, I think I'm more thinking of the positions we have that may have 20% of their time already doing things that are already up there. They may already have the right credentials to be the right practitioner, but we may have not properly aligned their job descriptions. That type of a review or analysis that in the works.
Would say that again, because of current,
And again, I'm not talking about this year.
yeah.
But I'm asking for the, like, is it the next year? Is it something that's on our list?
Because, yes, it is on our list, and because it has to be negotiated, that will be dependent on that time.
So so even if they're,
If they're not in a bargaining unit, it doesn't have to be negotiated, that can be developed and brought to the board, but for those positions that are in a bargaining unit, we have to go through that process.
And I really want to make sure that when we come to them, we have a workflow worked out that
Right.
works for them.
right,
And we're not there yet. And so I think that we need to be engaging in negotiations during the 25-26 school year. And then expect that as we start that year after that, that would be the best timeline, because that gives me another year and a half, or 2 years really, to get this going. And also we want to make sure that, because when our like school-based therapists, their information is more of a mental health, and so it isn't pretty much all needing to be in Aries. Right now, we don't have a way to seamlessly connect those two things, and so if they said we want to do it today, we would have to have them enter their information into systems.
Mhm.
And that I just don't want us to do that to a work group. We want to figure out how to make these things work within the systems that we have.
Right, I mean, because that pulls away from time they have to work with
Yeah.
students.
And when we originally approached some of the members, some of the leaders in that work group, that was the feedback we got. They were very clear that they didn't want to, in order to get reimbursed for something that they were already doing, they didn't want to become less effective or less efficient.
Mhm. What is Aries capable of helping us here, or is this a whole rebuild?
In the reason that we're going with TAD Health is because TAD Health not only collects the information about the services, it allows you to collect the student information system that needs to talk with the state third party, which is Carillon. And if we were trying to warehouse that information into Aries, it would not be set up in a way that would go smoothly. It would have to take a double job.
So will parents have another login for this? In order to.
These aren't for,
It's single
yeah,
as well.
Parents.
Okay,
yeah,
As well
it's
as-
the providers.
But there actually, there may be a secure sign-in for a parent, but it would be done just as I think a token sent to them or something.
To add information.
Yeah, to be able to modify their medical records, that we store on Tab Health. So
So we don't need Aries to work for this because we went this route.
I would love for Aries to collect this information at registration. The parent portal isn't customizable enough at this point. But there are many districts throughout the state of California who are knocking on Aries buttons and say, please upgrade, please
Yes.
upgrade.
This
And
might be something.
We're
we
one
should
of them.
do.
Oh,
yeah,
yeah.
no, this is going to be
Yeah.
something
Okay.
that
Our
student
team
information
has been-
systems in the state of California. And if this works in the state of California, other states may move in this direction to fund these essential services.
It
And
would behoove Aries.
yes, yeah,
Let's
if you're
hope one
listening.
of
I
them-
can
yeah,
see
I was
them
gonna say.
eventually creating something, it's just, it's a big lift.
Yeah.
And they are not quick to jump
No.
on any of these.
It's a big
So
lift.
could another residential, another district in the area uses another program. I won't say it, but they were able to just put a form in and it worked smoothly and perfectly.
We should clip that and we can send that over there.
Yeah,
Yeah. Any other questions? Comments? All right, thank you both.
Thank you so much.
Thank you all.
May I get started? Is that okay?
Yeah, so we're gonna move on to item 3B, fair technical education grants and funding. And my intent today is that we will reschedule the items in 3C after a brief presentation on them. So we'll probably leave 10 to 15 minutes, but a lot of that needs the rest of the committee here. So
Okay,
so we'll spend about 15 minutes on 3C. I want to receive your information because I know you worked on it, but
on 3C you mean, or 3B?
for 3C, so we only need to leave about 15 minutes for 3C. Thank you.
Okay, wonderful. Good afternoon. My name is Debbie Cardozo. I'm the Director of College Career Readiness for Santa Rosa City Schools, and I'm very excited to be here today at the Board Finance Subcommittee to share a little bit more about our for technical education program, specifically around our initiatives and funding pieces. So I appreciate the request to provide this information. Attached to the board agenda is a document that outlines our current grants that we have available. Local, state, and federal initiatives connected to grant opportunities provide direction for our work in CTE and our leverage to expand, enhance, and improve our programs. Annually, on behalf of Santa Rosa City Schools, I apply to CTE incentive grant dollars, Perkins, and also work with our agriculture programs on the agriculture incentive grants to support our CTE programs and meeting the 12 elements of a high quality CTE program. And so, could it be, do you want me to share my screen? Would that be?
I would say I'm trying to get to it,
No,
but I
that's
don't know
okay.
if I can,
Yeah, my computer's
My computer.
cycling also.
Yeah.
oh, I thought I
Yes,
disconnected from the.
Our internet is a little bit slow today.
Yeah, it's been tricky today. Let me see if I can make this work.
Yeah.
Does that work
it's
okay?
just-
I can't see.
This
up
is
there,
me,
but-
so I'm gonna disconnect from the screen mirroring.
Okay,
I think we look
Tricky
here.
today.
There you are. Okay.
oh, wonderful,
I'm
okay,
gonna do it
great.
this way.
Yeah,
You're sharing on the Zoom and I'm sharing in here.
okay, perfect, great, thank you. And so I just went over the CT incentive grant, Perkins, as well as the agriculture incentive grants. I've also applied for 5 college and career access pathway grants to support expansion of dual enrollment opportunities at our comprehensive school sites. And then last month, I actually submitted 2 more CCAP grant applications, one for Ridgeway High School and then one for our district to support this work. The Golden State Pathway Grants support integrated CT programs, work-based learning, student supports, and again, access to early college credit opportunities. Healthcare was one of the priority sectors for the state and is also one of the top 5 sectors in our county. Therefore, we applied for an implementation grant at 2 of our school sites that have existing healthcare programs and planning grants for the 3 other comprehensive sites, which we have been working on building healthcare career-focused programs. So as you can see at the bottom of this first part of the spreadsheet, that totals a little over 3.5 million. in active grants, that we are the, LEA, so the lead education agency on. So that's very exciting. And then in addition to the grants that I applied for, on behalf of Santa Rosa City Schools, we also work closely with other partners to secure additional funding for our CTE programs. So again, as I've mentioned previously, we are very fortunate to have a strong partnership with the CTE Foundation of Sonoma County. And recently has leveraged ARPA grant funding to support the new school model work at LC Allen High School. We will be providing an update on the new school model work on the April 23rd board meeting. So looking forward to sharing with the board a little bit more about how that funding has been utilized to really lay a solid foundation at LC Allen High School to launch other work moving forward. We are also a part of the consortium grant where SCO is the lead, the Sonoma County Office of Ed, for a K-12 Strong Workforce Program grant to support the development of the education program at LC Allen High School. Again, with early college credit opportunities at the SRJC. And then we're also part of another consortium grant through the county office. It's not on the spreadsheet because I'm waiting for the exact dollar amount from SCO that'll be allocated to Santa Rosa City Schools to support the work. But the initiatives are very much in alignment with our applications that we submitted for the Golden State Pathway Program. And then on the backside, I really like this visual a lot. And the reason I say that is because I really feel like this slide does a really nice overview of the different grants and initiatives at the local, state, and federal level. And then ultimately, what I appreciated about it is you'll see a lot of similarities for the different buckets, right? And so whenever we apply for different grants, and things of that nature, I'm being very thoughtful and intentional on how we grade that funding to ultimately support, developing those high quality CTE programs that are aligned to all the different initiatives, that you can see on the screen. And so I really like showing this as kind of like a snapshot of, all the different things that these, grants support and the initiatives that are going on in our district.
So just
Yeah.
when we're talking about the definition of CTE,
Mm-hmm.
I see early college credit in several of those categories. I think a lot of times you think of it as CTE is the career technical alternative, but it seems like college also, can you just give a sense as to what program CTE covers versus so what special programs we're doing that it doesn't?
Yeah, yes, and that's one of the things that comes up a lot is the career technical education has been deemed as one of those programs that are for students that are not going to college, and that could be further from the truth. And as you can see, I mean, it aligns very much with state and federal initiative, not only, you know, what we're doing at the local level, but CTE is for students going to college, right? But it also provides opportunities for students to choose a wide variety of opportunities and options after they graduate from high school. And so I think that's one of the biggest misconceptions about CTE. And so I really appreciate the state's push to provide funding in CCAP, so the College and Career Access Pathway Grant funding, because that really supports what we've been saying all along, that CTE is really for all kids. And so, so where we are shifting and really trying to elevate is by securing these CCAP grants. We are specifically looking for JC partnerships, because it's what the JC is the requirement for the grant, that are connected to our CT programs. And so the idea is to build stackable credentials so students can continue on their education after they graduate from Santa Rosa City Schools. So I really appreciate that. Absolutely. And then we have, I mean, even before we had these CCAP grants, some of our CTE programs have articulation agreements where students can earn early college credit through a credit by exam process. And it's our high school teacher that worked with the JC instructor to determine that their curriculum was in alignment. And then our instructor proctors an exam typically at the end of the year, and students can earn college credit through that way as well. Where the CCAP is different is it's a dual enrollment course, and it's higher stakes because the credit by exam option, if the kids for whatever reason don't pass, it doesn't go on their transcript. And so we typically record grades A or B, whereas for CCAP, it's an actual college class. And so the reason I share all that, I know it's a lot of information, but we've been working all along to try to really start providing these early college credit opportunities and setting our students up for success, in our CTE program. I hope that answered your question. What other questions do you have? I could talk about CTE all day.
So
You do.
Yeah, I do. I love it. I love it. Anybody that'll listen, I will tell them about it.
So throughout our district, we have a lot of programs that match that may or may not fit in here. We have a sense of how many programs we have that would be amongst our special programs that are not currently getting grant funding.
Yeah, so, on this first slide here, I added a column, this is the third column that says what CTE programs are essentially eligible for those particular grants. You'll see the little asterisk next to it. And on the bottom, it says the geospatial technology and health science and biotechnology program at Pioneer High School are district recognized CTE programs, right? But unfortunately, they are not eligible for like the CTE incentive grant, Perkins grant allocations because of the teacher credentialing requirements. And so although we do have those two programs that are doing everything right in CTE, so really working towards those 12 elements of a high quality CTE program, but they don't have the correct credential in order for me to be able to allocate resources to those programs. We do have, though, educator effectiveness grant funding, which we've been utilizing to support teachers with securing a CTE credential. However, they need to have industry experience. And so if that teacher does not have the industry experience, which unfortunately these two programs, one of them might, so we're working on that, but the other program teachers may not, or do not. And so they cannot get that credential, because essentially for the Perkins grant application, I actually have to list all the credentials that our teachers hold. And then when we have a federal program monitoring, I have to show documentation that our teachers also have the correct credentials. And so the state monitors that. And so we have to be very careful with how we allocate resources. But all the other programs in our high schools are eligible for CTE funding. And then which I'm actually really excited about, the CTE incentive grant one at the very top where I said, hey, we received preliminary notification. It's line 2 in January. We just received the grant award notification today. And so so I was like, oh, this is perfect. So we have $1 million, and not only are we supporting high school CTE programs, but that grant application, I specifically targeted middle school programs. Because we did at Santa Rosa Middle School, we have what's called a college and career readiness lab. It's kind of like a CTE wheel. And students go through 10-day modules where they learn a little bit about each of the different industry sectors. And then we actually have funding that I secured also part of this grant where students can, they do like mock interviews, but recently they just did like mentorship opportunities outside in the community with industry partners. And then we had some push into with industry as well. And I share that to say that I want to expand those.
Yeah.
And so I'm working with, as we're merging our schools and looking at consolidating Montgomery and Slater, I'm really trying to look at, okay, well, maybe that could be our next entry point to provide a wheel, a CTE lab, to again, provide those students exposure early on, so then they can make an informed choice when they pick our high school programs that are offered across the district.
Are CTE grants typically for startup or for ongoing provision of the course?
Yeah, great question. It depends on the grant. Yeah, so the CTE incentive grant and Perkins, those are annual grant applications as well as the ag incentive grant. So those are pretty like kind of ongoing. The big thing with those types of grants and really any of them is they're intended to supplement, not supplement. And so we have to be really careful that we're not saying that, oh yeah, we have CTE and grant incentive grant dollars or Perkins grant dollars, so we don't have to worry about supplying district dollars to support the programs as well. And then they also require, I forgot to mention, I apologize, some of these grants do require a match. And so like the CTE incentive grant, for example, requires a 2-to-1 match. So every dollar we get from the state, we have to show that we're spending $2 on CTE. We typically use salaries for that, as well as some other funding that the district allocates. And then Sorry, go ahead.
Is it 2-to-1 general for all CT, or is it specific to that CT program?
It's specific to that one. So CTE incentive is 2-to-1,
Mhm.
ag incentive is 1-to-1, and then K-12 strong workforce is 2-to-1.
In each of those situations, can we use the same matching dollars?
No, so that is why I love my fiscal friends so much, because they help me figure out, okay, how much can we apply for?
Yeah.
Because we want to go after every dollar that we can, but we also have to be conservative, because we also have to show projected amount of funds that we will support beyond like the grant term. So like the CT incentive grant requires kind of like a 3-year plan for that. To speak to your question, the College and Career Access Pathway Grant, that was SARTA. So that would the state really wants us to start doing these early college credit opportunities in our schools.
Mhm.
And we are specifically targeting CTE connections for that. And then Golden State implementation is to expand work that's already happening, but then we also have the planning grant at our 3 comprehensives, and that's to kind of just start thinking about it. And the state is holding on to implementation grant funds to award those schools after successful completion of the planning grant. So it really depends on the grant. Yeah.
So similar question actually to the last item, do we have jobs that we're currently spending money on that could be used or in part used for matching, where we need to do alignment work to be able to use it for matching, or are we pretty?
I think we're pretty good on that part right now. I don't think that we've identified areas where we're lacking.
So we've already maximized what we can use for matching.
I would say.
Yeah.
There may be, I mean, as we look at,
Right.
there may be something that we say, oh, wait a second, we weren't looking at this as a way to match, but,
Okay.
I mean, I think that's something that we're always looking at and refining.
Worth asking.
No, that's good. Yeah.
Absolutely. No, they've done there's a great partnership, between our team with Debbie and our fiscal team.
Debbie's the best.
Within the college programs, the dual enrollment program, I've heard conflicting reviews from parents, this is specific for Sanders High, because I'm talking about those parents that are like, it's really hard to do dual enrollment because I gotta run back and forth and do
Yeah.
paperwork back and forth.
Yeah.
And then the other side of it is hearing from parents who are like, oh, the school took care of the dual enrollment applications for me. Is
Yeah.
that the difference between being in a CTE program and not? Or what's the?
No, I love that you brought that up,
Yeah.
because that is something else as we are, I mean, we're pretty new to the CCAP. And so you'll hear them called random acts of dual enrollment, right? And that's where, right?
Kind of how I'm hearing it right
Yeah,
now, so.
Student, as been over the high school, I'll just use them since that was the example, will go over to the JC and take a dual enrollment course while they're ours, okay? So that's I call it a random act, and we hear it a random act of dual enrollment, they just go over there and take that course. CCAP is very intentional, and what's different about that too is that it's offered on our school campus during the school day, taught by an SRJC faculty or one of our staff that meets the minimum qualifications of being an SRJC faculty member. So one of the big pushes around the CCAP grant was providing greater access to students that may not be able to access a dual enrollment course because they can't drive to the JC as an example. And so it's in our area system. It's so the reporting on the transcript happens a little bit more seamlessly versus if it's a random act of dual enrollment where the kid has to bring back their transcripts and verify and all the things. And so it's different. So this is a CCAP is during the school day on our campus, whereas the other ones are like they're just randomly going to the JC. Yeah, does that make sense?
It does. Is there anything that we could do to make the random acts less painful bureaucratically?
As far as like getting them on the transcript
I
or,
just hear from parents that it's a lot of driving back and forth and asking for paperwork and not
Okay.
getting filed correctly
okay,
and so I was wondering if that was a part of this type of I think there's also some of that benefit of going onto the college campus and getting that
Absolutely.
experience. So if
Yeah.
there's a way to make that more seamless.
Yeah,
while getting funding to make it more seamless.
yeah, I know that would be nice, right? Yeah, no, I definitely agree. Getting on this, on the JC campus is really great. And so we've been working with the JC and figuring out how do we do like a bridge program or something to that effect, or even though that they are our students on our campus, how do we get into the JC? Because they get access to all the services at the JC because they're essentially a college student. But I could look into the random acts of dual enrollment to see if I could help make that more, smooth and kind of, talk to our counselors and see maybe where some of the hiccups might be. I would offer though that, we should also look at enrolling our kids in the CCAP classes. Because it's pretty slick. So, yeah.
Awesome.
Yeah.
And then another combination question, so with. I know that lots of parts of the arts are also CTE.
Mhm.
And with the Prop 28 fund.
Yeah.
Is there places where we're able to combine Prop 28 as a part of the matching within the CTE programs? And are we doing that work? I know we got Prop 28 on a future agenda also, but specific just to this item.
Yeah.
Is that a?
Sorry, I was multitasking
That's
for a moment
okay.
there.
Yeah.
Just a question.
$28, specifically, you're asking in the arts, media and entertainment.
So we
sector.
could use that. So if there's a site that's that has that as part of their plan, because remember Prop 28 is at a site.
Right.
It's not a district plan. So if there there is a site that's using that, if it's coded correctly to with a CT goal or function, then that should be picked up in our match. And that could be that offset. But again, I caution us as far as doing that, considering their site plans, not district plans. And so the alignment of that, if they chose to change how they're using those dollars, that could create a potential issue
Well,
on
I'm
that. in the
specifically
future.
thinking like for sites that have like the intentionality of like art quests
Right,
with their new tracks or post Prop 28. Stage craft was post Prop 28, like, but that's also very much a CTE concept of doing stagecraft.
Yeah.
So is there a way where we can get the
Well,
site plan knowingly?
it all again depends on the credentials and the.
Credentials, and it has to be new, so it
Yeah.
can't be something that
Right.
that we're offering already, so it'd
Right.
have to be a new program. And then what is also, and I'm glad you brought up
Is it new
ArtQuest.
for CTE or is
It's
it new
new
because
for
of
Prop
Prop 28?
28, as was
It
my understanding.
I know it's new for Prop
Definitely
28, but-
For Prop 28, and it would depend, I mean, it wouldn't have to be new for us to count it as a match, but
Right.
depending if we were trying to fund it with a CTE grant or something like
Yeah.
that. then that's-
And then for, and since you brought up ArtQuest, we also have to be careful too, because CTE needs to be open to everybody.
Right.
And so we can't have like an application process or screening process or anything like that as a part of the program. Because that would negate them being eligible for any of these other, like the CTE incentive grant or programs. So I said, hey, this is access is a big thing. So it has to be open to everybody. So if that program was interested in doing something like that, when we'd have to get aligned, their curriculum would have to be realigned to the arts, media, and entertainment industry sector, which the state's kind of going through a revise right now on that. And then we'd also have to look at their current process, because I think they have some sort of screening or application
So-
right now. Yeah, so,
We can
yeah,
Keep that for some of those things, so.
yeah. So it's possible. We would have to kind of figure out where it would fit.
What, pick a random program other than ArtQuest and
Yeah.
let's apply the same question.
Okay.
Spark, that wouldn't be Prop 28, I think it was Prop 28 that VCT overlap. Bands,
Bands,
like bands,
Yeah, so we could look at that as long as we would have to realign and make sure that the standards that they're teaching match the arts, media, and entertainment industry standards. And so I haven't done a correct, like a, you know what I mean, like a match, like across.
so I know
between
the
NAPA
matching,
standards.
I know the matching of CTE is like
Mhm.
one of our big constraints on being able to expand CTE.
Mhm.
But Prop 28, we're in the first year of receiving guidance on how we can actually use it. So in some ways at the ground level of being able to advise local school
Right.
districts that if they lined it properly, they might then be able to get eligible for grants. Or am I reading too much into this?
I think we're probably reading too much into it. Yeah,
I think it's getting more complicated than it actually is, yeah.
I appreciate you looking for
Yeah.
additional
Right.
matching though, you know, so and resources,
Yeah.
because the more we could leverage is always, you know, it's great, so.
Yeah, the more we can interlink.
and as the state expands credential options
Right.
for CTE.
That's the other big one. What's the credentialing? Is it that does all CT have industry experience? Is that the issue?
Yeah, it depends on the credential. There's 5 and I can give you some more information on that, but, like agriculture. Like I have an agriculture credential and I have a specialist credential, and so I don't need to have a designated CTE credential to teach agriculture, as an example. Business, I think it's home ec, which is the culinary. There's an industrial, technology that some of our teachers hold, and that enables them to teach like construction, manufacturing, or things like that. And there's one more, I don't know.
There's a
it's gonna
computer
come in there.
science one.
Maybe that's what it
technology one.
is, yeah. And so, but then outside of those, then you can get a designated CTE credential. And so typically when an individual I know has, some sort of, you know, industry experience under one of the different industry sectors in CTE, I will, connect them with the county office, their credentialing technicians, and they will verify, like their hours that they've spent in industry. I think it's like 1,000 hours that they have to verify, as well as other things. And then they also have to do, like a program requirement too. So, and then that would enable them to teach in one of the different sectors. Yeah, or program within one of the different sectors. Yeah.
Are we not is there anything we're not pursuing in CT? There was something, I'm sorry that trustee Kirby wasn't able to be here, because, he was specifically talking about there being some type of collaboration in other counties.
Mm.
The name of it is escaping.
I think you're probably thinking of, ROP, right?
Yes,
Yes.
yeah.
Yeah.
So what's the situation with ROP? Why don't we have them in Sonoma County?
Yeah, so I actually reached out to the county office to find out a little bit more information. I want to say back in 2013, 2014, when the state started redirecting funding to, for the, right? You
So,
probably know better
so
than I do, yeah.
historically, I can't speak specifically to Sonoma,
Yeah,
but in 2010, during the recession, there was flexibility given. And county offices no longer had the requirement to use their funding for ROP, just like we had flexibility in the way that we were able to use our funding. And so many county offices stopped operating those programs. It used to be that they would, like where I came, in that time I was in Lassen, and our county office gave huge support and offered a lot of ROP programs in ag, specifically at our high school. And when they had that flexibility, just because everybody was trying to keep operating, you know, to continue to operate, they stopped operating those classes on our school site. And because they no longer had that legal obligation to do so. And so we continued to offer CTE classes, but they were no longer ROP. ROP has to be open to more than just our schools, our school students. Typically, they're also open to adults and neighboring, you know, there's a lot of things. There is a metropolitan education district down in San Jose is a big ROP center. I think there's a couple of them in the state. I only know about that one because a friend of mine who was CBO there for a while.
So it's now, and so it's still just an optional thing out of the county office. Okay.
I did reach out to the county office to find, a little bit more information. She will get back to me, and then once I have that, I could relay kind of what, because like you said, it's dependent upon every county office.
Yeah.
Yeah.
Yeah, my other county office chose to pass those dollars or to still operate classes, but they no longer called them ROP. And they were only limited to the district students. So everybody does a little differently.
It's good to know.
Yeah,
I said, well, thank you very much.
yeah, thank you.
Anything else you want to add before?
I mean, there's always something I want to add. Yeah. But I'll say that real quick. No, I just appreciate the opportunity and appreciate, the genuine interest in our programs and support, and I'm happy to be here today, so, yeah.
Thank you so much.
Yeah, thank you.
Okay, so for 3C, what I want to do is fully receive everyone's updates on these items. So I can request our other committee members watch this video.
Mhm.
And then we'll take up discussion at the next meeting on these with the other ones.
Okay, so full discussion so that they can see it and then the follow-up next time.
Exactly, and then we can go through for, as we're developing the process, but
Okay.
that way we don't
So we'll go ahead and
get behind, because June's gonna come real quick.
And really, the presentation that our fiscal team prepared, so thank you to Joel and Simona and team. Has quite a bit of information in it, so we'll go through it pretty quickly. And
We don't go
And
too fast.
simply, yeah. And Simply was not cooperating. I'm glad you
Yeah.
printed it out because I can't see it from that far. So thanks.
move that up there. So, and I think that Simona may have made some additional updates on the audit slides, which we'll go to, so. If there's additional revisions that we need to make to this, start kind of, okay, how do we approach this? So really appreciate, like I said, our team for doing that. And so I got Joel here with me, and we'll just kind of work through here. Let's see if we can get that. These are just kind of the items that are covered in the presentation. So just the state, their standard structure is called SACS. That's also the name of the system that we do reports in for our financial reports. So you'll hear SACS used in a couple different ways. And then the manual, if anybody's interested in reading it. But that is where all the rules are. Is in the CSAM, which is linked.
And this is where I'm very familiar with GAP,
Mhm.
but all the other stuff, I'm like, no, that's what I need to go to school to learn.
Yes,
Yeah.
so definitely a difference. So yes, everybody uses GAAP, which are the generally accepted accounting principles. However, we also have additional things, which are, it's called GASB, which is the Governmental Accounting Standards Board. So, and like, there's FASB in the private sector, so there are different boards that provide guidance and requirements to how we operate. And again, our fiscal year, July 1 through June 30. This is an overview of what our account code structure looks like. So the fund, so when we're talking general fund, that's Fund 01. We have other funds such as Fund 13, which is nutrition services. Anything outside of Fund 01 is going to be restricted in nature. And then Fund 01 has restricted and unrestricted resources within it.
Okay, explain that.
So we'll get to that. So number 2, so the fund is a 2-digit number. If you look, no, it's 0, it's 01 or
02?
no,
Okay, got it.
no.
Got it, okay.
Sorry, so if we look here,
Mhm.
it's a 2-digit versus a resource is
got
a
it.
4-digit.
I've got it.
Okay,
So this is when you're looking at the board agenda and there are fiscal items and it's talking about the fund and resource. Yes, these
This
are
is
the
the
things
accounting.
that you're typically going to see most
Okay.
often. The fund, so if it's general fund, it's 01 or it'll say general. If it's the resource, then we'll get into a little bit further how to understand what those look like to tell whether it's restricted or unrestricted and whether it's state or federal or local. Project year, we don't use that very, very often, whoops. But some districts do a lot of accounting using that. That is extremely labor intensive when you do so. Just as a why some districts choose not to. And there are some things that may require a project year. A goal is, think of it this way, which students are we looking to serve? So a goal 5,000 would mean that it's supporting special education students, for example.
We have those goal numbers.
So that's actually set by law, but that's in the CSAM. So yes, if you wanted to look at one of our account codes, if we were to print out all of the different things, we're talking hundreds, maybe thousands of pages.
Okay.
To look at all of the different codes. function is kind of the what we're doing, so, it's similar, the goal and function are tied together, so they're, and within SACs and CSAM, there are certain combinations that will or won't work together, so it'll give you a fatal error, we can't submit our reports, all of that, if it's not things that are allowed to work together. Object is, that's another thing that you'll see quite a bit on the board, it's, so 1,000, anything in the 1,000 is related to certificate in staffing, anything in the 2,000s, it's classified staffing. 3,000s benefits for all staff, it's not broken out by that first digit, there are ways to tell by going through all the detail of it.
Okay.
4s are materials and supplies, 5s are typically services, contracts, things like that. 6s are, I'm trying to think of a six.
Capital outlay.
Thank you. I'm drawing a blank right there. Yes. So capital outlay. Typically that is used more in our restricted resources, but you will see some in our unrestricted. 7s are like indirect and charges like that, which indirect is when we have restricted funds. And it's basically the kind of administrative cost of operating those restricted resources. That's actually how we pay for much of the things that are supports and operation in business services. Or typically that's how you fund that, is from indirect from restricted resources. So while we aren't paid out of restricted, aside from probably something in bond or child nutrition, deferred maintenance, all of those reporting things, which is, there's a lot of reporting that goes in and management that goes into the restricted side. That's how we support our business office, is by charging those fees.
Do you have a sense of what that percentage is for?
Yeah, it's actually adopted every year, and so it varies, every district is different, and for us, it's 5%.
5%, mid 5%.
The school, that again, that's the last two are not necessarily things that you will always see. They're things that are set up specific to our district, so a site or a management code. So Joel can speak to that a little more if we want, because each district and each
Does them
county
differently.
they do them differently, even to the point where they're in a different order.
Would
And
Would the different school, like, would column 7 be utilized for us to differentiate between the different charters and our?
So our charters are actually required to be, they have their own
Their
fund.
own books?
Right. So it rolls up into Fund 09.
Yeah, that's
Yeah.
where I think I just have
Yeah.
the first 6 codes are required. And that's what you'll see in the SACs reporting state software, and that's kind of uniform for all school districts, but locally in our local financial management software, we add the 7 and 8 codes.
And in SACs, because we have 4 different dependent charters, they roll up. Because we don't have a way to, within the state system, separate them out. So when we transmit between us and the state, all 4 of our charters get rolled into one and sent in. But internally, we track them separately in different funds that roll up into them in 09. So that's a really short description of how all of these things work together. Just our annual reporting cycle. So just wanted to make sure that that was included in here. I think you've probably heard this enough from Joel and I during our budget reports. And these are just some supports that are available to us, some information on there on ways that we receive information, how we receive guidance. So part of SCO's role is to provide support, training, and oversight. So the ways that we support that. Here's where we get into the unrestricted resources. So a lot fewer unrestricted resources because you don't have the same level of reporting requirements. So again, that 4-digit number that comes after the fund, 0000, is what most things are tied to, is that is our unrestricted base. So between the elementary and the high school, I think next year we are expected to have 140,000-ish, 148,000, sorry, 148 million-ish in unrestricted base. On top of that then is our local, our supplemental and concentration, which we track internally as 0500 in the reporting to the state. Sorry, within SAPs, 0500 pulls up into 0000. So in our LCAP reporting, we have to break it out. And, you know, what we spent in supplemental and concentration, meeting our minimum proportionality percentage. But it all rolls up when we report it to the state in our books. So that's why we actually have two separate documents. The LCAP actually reports to the county office how we spent those supplemental and concentration grant dollars for that piece of the oversight. State unrestricted lottery, 1100, and EPA, which is really, again, that is a proposition that we didn't used to receive those funds. So back during the recession, in 12-13, before the local control accountability plan and LCFF actually took effect, Governor Brown put forward a proposal, and it was approved by the voters, that there would be an add-on, and that was to protect our funding. And during, so it's this weird calculation. We don't actually receive extra money for it. It's included in our overall, that overall $148 million, that base funding. It's just a percentage of it. So if we didn't receive, if that legislation was not renewed, that funding would come off of that entitlement. So that's a really short overview. I know it doesn't sound short, but it is in comparison to really the mechanics of it and what that looks like. So again, unrestricted EPA funds cannot be used to pay for administration.
Okay.
So in each budget adoption, we do have to say how we are using those EPA funds.
Yep. And that is a part of what goes to the state, or is that a part of it gets rolled up like the cap?
It's actually, it rolls up actually in the state reporting, and where you will see it is only once a year. Which is actually when we're looking at our unaudited actuals, and we say how we spent the funds in this past year. In my prior district, we declared upfront how we were going to spend them. Here we'd say how we did spend them. So a little bit different.
Is there an advantage or disadvantage to those two?
It's a different requirement by county.
So it's different
How
county.
the county accounts for it.
I mean,
The guy.
I think, I always thought the rationale was because at the end of the year, we know what the final numbers are, so we report them accurately, but we can talk about it.
Yeah, no, it's, I don't have any concerns with the way that we do it. It's essentially just showing that we don't spend it on administration.
Yeah.
That's really all. That's the point of it. Okay. These are our restricted federal resources. So federal resources are typically, so it goes from 3,000 to 59.99. I don't know that I've ever seen a federal resource tied to a 5,000 resource code. Typically they're 3s, and then you get into some of the 4s. So each of these are very specific. These are the things that when we do, as Debbie mentioned earlier, the federal program monitoring, these are the things that they're looking at to make sure that we are spending our dollars or providing the services in alignment with the restrictions. So Title I is restricted to our low socioeconomic. CSI, we no longer have any CSI schools, so that's great. When we do have them, we receive specific funding that is incredibly restricted. ACEs, again, that we tie those funds we braid them with our ELOP funds to be able to make sure that we're providing after school programming. federal special education, so that's a small percentage of what we get. Their goal was to provide 40%. I think that's what's in the IDEA when that was first brought up. They've never gotten anywhere close.
I was
Um,
gonna say, that was a fail.
Right, exactly. So you can see there are several things that are related to special education. And, Go
For
ahead.
context, I can add a
Yeah.
fun fact. So that
Sure.
3550 is that Perkins grant that
uh-huh,
Debbie was referring to. That's
yep,
So 3550 is the CTE that we're just talking about.
exactly.
Okay.
Title II, that is specifically for certificated professional development. The only time, it's very limited when you can use it for classified, which is specifically only to credential monitoring. So making sure that we can appropriately assign.
And those grants, are they grants we have to proactively apply for, or are they granted to us in?
So it depends. So Perkins is a grant app. It's not an automatic. The others, most of the others are an automatic based on enrollment or certain populations.
and then the title finds seems grant, but we do the Con App, and there is a little
Yeah.
application for that.
Yeah, it's, thank you.
There's a
Yeah,
lot of
it's,
work to
it's called the consolidated application.
Mhm.
And it is not you don't write your typical grant application for it, but you have to provide a lot of information
Mhm.
and it's very cumbersome. So that is, there are a number of things that are required for any federal funds especially, are incredibly labor intensive.
Yeah, there's a lot of compliance behind anything we get from feds. Think of it as the old categorical.
Right, and it's on the front end and the back end.
Yeah.
So before you get the money, when you're spending the money, and after you've spent the money, and most of it is on a reimbursement basis.
So part of what we're looking at today and reviewing, so if we'll review these in lots of different contexts in the meetings,
Mhm.
but we're looking at it from an internal controls and audit process. What's the best way for us as board finance committee to look at this and know that if Lisa and Joel aren't here, we have someone new here, that we're doing this right? Like, how can we do that?
So forgive me for saying it in this way, that would not be
Not be.
the role of the
Well,
board.
I'm not saying look at the documents
Right.
themselves, I'm saying, how do we know that all these funds are in a detailed way? You read in the news when it's like,
So,
this thing's not approved because it wasn't done right, so how do we prevent that through?
so that's through our audit process as well as through our oversight with the county office. So internally, we have, parameters as far as a requisition is submitted, then, reviewed, all the different workflows that it goes through for approval and payment. Those are when you're looking at contracts or looking at, staffing, all of those things, that's where this is. And again, 85% of our budget
Yeah.
is staffing. That's where a lot of this is going to be, is reflected in staffing.
So, like, one of the moves that we were just making was to combine some of our staffing to have one title, one person responsible for all Title II problems.
Mhm.
We would, through the audit or through the SCO review process, know whether or not that was a successful decision or not.
Right, also federal program monitoring. So we have not only our internal, smaller districts aren't typically selected, for federal program monitoring nearly as often as we are. So because of the amount of federal funding that we receive, we have an FPM every couple of years.
And that process requires everybody to work time and a half literally, because the amount of that have to be uploaded and sorted and is humongous.
And when those are completed, they come to the board as a report out item or?
And we actually completed one in the fall and thank you. I'm very pleased to say that we had no fiscal findings whatsoever.
Like I said, for an event that
Thank
we
you.
don't have you all here.
right.
You know, that's the,
But that's a testament to the fact
Right.
of this, that is an area where we do have good systems in place. One thing that has been, very labor intensive is going backwards. And so, yeah, with all of the COVID funds and the type, the ongoing federal funds, there was a lot of shuffling to make sure that we were spending out the most restricted dollars first within the timelines. And so there's a lot of movement over the last few years that we shouldn't see going forward because we don't have those one-time funds that when you have all of these different activities that qualify to be spent with these restricted funds and maximizing which dollars we have to use first, shifting where those were paid from. That was a lot of detailed work going backwards each year. And that's where I'm very, very pleased that even through our federal program monitoring, all of those changes that we did, making sure that we were maximizing those restricted dollars and getting, because if you don't spend those dollars or you don't spend them in the right way or by the deadline, you lose out on them. And so, again, a testament to the work that was done on that between ed services, HR, and fiscal, because all of those things have a piece in that. Okay. State restricted resources are in the 6,000s through 7,999. And they run for a variety of things. Each of these also have, very specific requirements. And on the federal side, most of those have a no supplanting requirement. On the state side, it really varies. There are some things that you can't supplant and others that it's fine. That's really across the board. You also, here's something that happens with state grants, is they will give you 2 grants with the same name with 2 different resources to be split on 2 activities that are related, but
Different.
you have to maybe track your certificated staff in one place and your classified staff in another, even though it's already broken out, or where it's very specific activities. So those are the things there. STIRS on Behalf, I want to point this out because STIRS on Behalf is really, it doesn't really mean anything in that it's a journal entry that is done that shows that the state gives us money and that we pay money out when there's not actually any transaction there that happens.
Yeah,
So you'll see
Journal entries.
offsetting, yes, you
Yeah.
will see offsetting revenues and expenditures that really aren't, the money doesn't come in and the money doesn't go out.
it's like the state just puts it into STIRS in the first place. So journal entries. Got it.
It's, Yep.
Interesting.
yep, exactly. So that's what we currently have in that state restricted. And then we have locally restricted, and locally restricted can be restricted by grant requirements. Sometimes we do have grants. Some are locally restricted by donation, or any number of reasons. It could be a scholarship, it could be very specific things. So you have sites and like here where it's site defined, I mean, we're literally, it can be, okay, this is restricted for this particular purpose.
another little fun fact, you see that one in the lower right, that's
Yep, CYBHI,
Eric's.
yep, so that's a
So-
locally restricted, right?
Within these, are these like donor directed or?
It varies. Some of it's donor, some of it's awardee, because it's maybe not a donation. Some are, depending on where it's from, what it's for. So some things we will receive will be a reimbursement. So like Medi-Cal billing, that's a reimbursement. That's actually a federal reimbursement, but it's still tracked as a local. Exactly.
Yeah, that's
So
the
that
fun
one-
nature of the SACS codes. There's
Right.
also federal revenue object codes that are in this. So on the
Mhm.
SACS reporting, you'll see it as a federal revenue in our local.
Right.
Within the ones that are. Do we have any that are like endowment style? Or is it mostly like a donation for this year if it's a donation?
So I would say it's more donations that come in and then they can be
Get
spent.
spent.
However, I will, here's Holler Revocable Family Trust.
Mhm.
So that's kind of an
Yeah,
endowment
that's
type.
the one I think's targeted for San Jose High School.
It is.
And yeah,
Yeah, that's specific to San Luis.
And so. Yeah, I guess if there's just one of them, it's slightly easier, but I guess my question would just be, what is our process for making sure that we stay within donor intent? If it's something that's over many years of.
Again, those are the way that you can set up restrictions within escape or, Yeah.
So,
the
and
not
it
very
will-
internal.
Send back that fatal error if we assign it for something that's out of the.
No, not necessarily. That's really where it comes down to human
Okay.
review. So our budget techs are really good about checking things as they're coming through from sites. Does this align with the intent and the language that's in there? Also, a lot of them have to have, like for the site-based, also go through ed services, and depending on, whether it's a title fund or whether it's whatever that looks like, their executive director may be reviewing it, it may be Dr. Castro. It's gonna depend on how that workflow is set up. But the biggest stopgap is our budget tax.
What is the Holler one?
It's a family trust that they made a donation in, that is specifically directed to Santa Rosa High.
Like specific thing, or is it kind of unrestricted?
It's, my understanding is it's the principal's discretion.
I was just curious.
Now, that was the intention, was for principal discretion.
Okay.
Anything else you want to add to any of that, Joel? You'll misspeak on any of our internal processes on that?
yeah, I think you. covered it.
All right. Again, more local resources. And when we roll things up, again, in SACs, a lot of them will roll up as an overall.
Actually, I can speak on that one.
Sure.
So we have that, we still utilize that 999 donations for district level donations, but. Within the last few years, we isolated all the school site local donations. You can see in the last slide, all those 911, like the school sites, they have their own donations and then we house them. And if you look, see those like 9230. So and then we just house their funds in our treasury account. But they would go through the principal and then.
Okay, this just is an overview of the audit process, just the really, the legal piece of it, and kind of the timelines there. One thing so for professional services, districts are not required to do an RFP or an RFQ. However, that is a best practice that every so often you do go back out and do that. So that, we've had the same audit firm. I don't know how long we've had. Do you know?
That's a good, I think. My first year here, the audit firm that was auditing San Jose City Schools, when auditing a lot of districts in Sonoma County. Stopped servicing some, so I think we did go obtain our current auditor there, so that was 8 years.
Do they need to rotate who the auditor is?
Yep.
They do. Yeah, every other year or
It's
every
every
third.
couple of years, every
3 years,
third year, I
can't
think it
remember.
is.
I think so. Although I think that ours tend to rotate more often
Mm-hmm.
than every 3 for their lead auditor.
How
Um,
often do we go back out for bid right now?
we haven't right now. We've just, I think the last time, so through June 30, 2025 is when the current audit contract is good through. So that means that next year, they're already under contract to review this year.
Mhm.
So if we want to go out for an RFP, a competitive process, we would start doing so pretty soon.
And is that I mean, it sounds like a best practice. Is there a number of years that is the best practice on that? Like every 5?
I have to say, I don't know what the best practice is on that as far as a time frame. My prior, we did it. I think we went out once during the time that, no, they had gone out a couple of years before I got there. And then a lot of districts in this last couple of years have gone out for that process because many audit firms have
Stop
stopped.
servicing.
Yep, after COVID, so during COVID, they were having the same issues that all of us were having as far as finding staff. And so you'll notice that ours as well as some other districts, audits have been delayed over the last couple of years, and that mainly has to do with some staffing issues.
Let's flag that as a question to bring back at the next meeting.
Sure.
And we'll continue.
Thank you. This is just an overview of actually kind of what they do when they're on site. So they come and spend usually 2 weeks here, one in the spring, one in the fall. And then just kind of the things that they look at in March and April versus what they look at in the fall when they're here. And in the meantime, we're sending them stuff in between, and they're working on all of these in the meantime. And then just a link to kind of the overview of what our board policy and things that we use for those internal controls. Essentially, the basing is to make sure that you don't have one person who is responsible for a transaction from start to finish. You have to have checks and balances, and whether that's for specifically purchases or positions, all of those things. So these are areas that while we have processes, we are looking to improve those. One area would be with requisitions. It used to be commonplace for once orders were received, then the requisition was submitted to pay the invoice. And that's really not, when you're looking to budget and know where you're at in any year, whether you expect to actually spend funds, if they're encumbered or not. You want to encumber the funds as soon as your contract is approved.
Right.
Then you'd want to encumber that. And then it would be, that's when the requisition and the purchase order. So the requisition is essentially the request to make a purchase internally in our system. Once that is approved, you're issued a purchase order, which is actually your authorization to go out and purchase. And then it comes through as an accounts payable, whether that's as a reimbursement or paying an invoice or whatever that looks like. Again, that's a process that we've been tightening up over the last couple of years. And then for employee supplemental pay, we've looked at moving, we're actually in a pilot program right now, moving those supplemental cards to Inform K-12 so that we can track that better. We know when there's an authorization given to work extra duty or additional hours or whatever, whatever the different payments will be for the different supplemental pay. So we can see that in there when something's pending, when it's authorized, and then it'll go through that workflow very similar to a requisition.
Is that a part of the employee control position?
Position control is different. Position control is something that's within Escape specifically. And it is what ties a position with the authorization for payment to fill it, all of those things. That's part of what ties into budgeting. All
So
of
this
those
would
things are
be a
within.
part more of like the whole discussion around 1 day administrative subs. That would be this conversation.
Yes, yeah, employee authorization forms and supplemental time cards, that's gonna be for. Working outside of hours. Typically are doing, having a differential pay, because somebody's doing a job. Performing work that's outside of their classification for a period of time, things like that are supplemental. Versus your regular, payroll is going to be set up within position control. Your other items are going to be processed through this.
That is helpful.
Okay. And then our contracts obviously really govern a lot of what we do.
Mhm.
And then, Joel team created some great, resources, budget 101 for staff. That takes us to, so internal, this is only going to work for staff, so sorry, but it will give you, an overview. Nah, I'm not gonna do that right now. We're gonna go back. But. Try this again.
I know the bargaining unit contracts are on the website, right?
They
So
are.
I guess that one.
Yeah, that's public. The budget 101 for staff is an internal facing document, so our staff could see it if they log in. Under the employee portal and not employee portal.
Staff hub.
Thank you, staff hub.
Okay.
And under fiscal services, there's little videos. And just the difference when we were doing our reporting at the end of the year, how we have to reflect our ending fund balance. One of the things that is not pointed out in here, but when we were talking about the federal funds and the titles and all of that, those are the funds that we have to budget as if we are going to receive and spend everything in the current year, even if it's something that we have a couple of years to spend or that's on a reimbursement basis. So that's where you look at. That's where you're gonna see a difference in what's projected in the estimated actuals and the unaudited actuals, because the amounts received and spent are going to, in the budget year, going to reflect everything that were awarded and would match the expenditures on that, because they both have to balance, it has to balance to zero.
Okay.
But then when you come into the unaudited actuals, it's going to reflect what actually was received and spent, and that has to align, balance to zero. And then you'll see later carryover balances added back in. So when we talk about the difference between what's budgeted, again, we had to budget as if we were spending it all out, so it's not reflected in the fall, and then we put all that stuff back in there. That's where that big difference, it was like $8 million that we had. People were saying, oh, at first interim, oh, you added $8 million to the budget. Well, not really, that was carryover limits.
So you carry it over, and that happens every year.
Yes, yeah, and so then the dollar amount related to that is going to vary by year as well.
So I'm gonna have you just hold on these last two slides, is that this was a part of the straw poll for today. So we'll take this up along with the question on the
Which one was the one we're taking up?
one-time fund policy and reserve policy.
Mhm.
So we'll take those up with the discussion for the RFP for auditor policy at the next meeting. But we will not make you redo the entire audit process. We'll have everyone watch it and be ready for the next meeting. So, all right. That's so we're at 5/25. We've added an informational item on school finance terms and budget process overview. That's gonna be on every agenda item going forward, so. I think that was the CSBA one. I think you added. another-
I did add another one on there, which I'll pull that out, give me just a moment. here.
The annual
Or
budget
maybe-
cycle overview.
Actually, I'm afraid if I tried, that it's just
Yeah,
they
don't-
loading,
Yeah.
so I'm not going to.
So we
Yeah.
added school finance terms and we added the annual budget cycle overview. We'll keep those in perpetuity. We can add other things here as we run into them. That we want to have on just all these agenda items.
Let's see, I should open it. It's
Yeah,
Yeah.
so,
second level.
Yep,
item 5, approval of the minutes. We don't have forums, so we'll take action on that at our next meeting, and then I will adjourn us at 5:25 PM.
thank you. There we go. Don't wait,